Is your body stretchy? Well, here's why it's important to recognize. Being flexible could mean more achiness, unless you know what to do. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrative Medical, and I want to talk to you about flexibility, stretchiness, and all of that good stuff. Now, if you know someone that's really flexible, you might want to share this with them. It could be important. And it's common for us to see patients here in our clinic that have long-term, ongoing pain, and many times they can't really tell you why. Well, there's no incident tied to the pain. There's just no real good reason for it and nothing to blame it on. And being an orthopedic specialist, I can usually get to the crux of the problem relatively quickly. But sometimes the puzzle is just confusing. And for the wrong provider, some of the puzzle pieces, they're just not there. They're missing. So one of the puzzle pieces we were missing years ago is hypermobility and instability. And when we see the signs, we have to back up and we've got to do some testing. Now I'll explain what I mean. As part of my normal orthopedic testing, there are signs that can pop up from time to time that suggest a patient may have some instability or hypermobility. And one of them is when I have them standing up and I just tell them to bend forward at the waist as far as they can. Well, if they're straight-legged and they put their hands flat on the floor, well, that means they're probably hypermobile, right? And that's one of my main indicators, but there's several little hints that if you're paying attention, you can pick up on. Another one, for example, is when a patient's laying on their back and I ask, can you raise both of your feet at the same time while you're keeping your knees straight? Kind of like we had to do back in high school. We had to raise our heels off of the table about 6 inches or so. So if their heels come up off of the table and you see the knees hyperextend, well, they're likely hypermobile. So I suspect now that they're hypermobile. Well, now what do we do? Well, if you think somebody's hypermobile, the next step is we need to put them through the BEIGHTON scale. The BEIGHTON scale goes like this. First of all, as I mentioned, do they have the ability to touch their palms flat to the floor with their knees straight? Well, if so, they get 1 point for that. Can they hyperextend their elbows beyond 10 degrees? If so, they get 1 point per side. Now, can they hyperextend their knees beyond 10 degrees? If they can, they get 1 point for each side. Do they have the ability to touch the thumb to their forearm like this? Well, if they can, they get 1 point for each side that they're able to do that on. And then the last thing here is holding their hand out like this, can they pull their pinky back past 90 degrees? If they can go beyond 90 degrees, they get 1 point for each side. So scores of 4 or above indicate generalized joint hypermobility. Now, obviously, the higher they score on this BEIGHTON scale, the more hypermobile they tend to be. And this means they are more susceptible to joint pain and overall chronic pain. For a picture and a deeper description of the BEIGHTON scale, go check out Physiopedia. Go in there and search Ehlers-Danlos or hypermobile or BEIGHTON scale. In general, a BEIGHTON scale score of over 5 or so should make a provider very suspicious of the patient having Ehlers-Danlos. Their connective tissue is made up of the same stuff as mine and everybody else's, but it's arranged differently to allow them to be stretchier and more elastic. Now, while this seems like a good thing on the surface, all of that flexibility and movement comes at a cost. And it means that there's typically more movement but less stability in the joints of the body. And when you have more movement, well, you have more opportunities for aggravation of the joints and low-grade discomfort or pain. And when that's allowed to go on for too long, well, then you start running into chronic pain. And chronic pain really can be an umbrella term, meaning other conditions are tied to chronic pain. They think that chronic fatigue, headaches and migraines, fibromyalgia, depression, and sleep issues, that's just to name a few, but all of these things they think could be tied to chronic pain. Maybe even autoimmune conditions like lupus or rheumatoid and some of those sorts of issues. And then there may even be a potential connection to systemic autoimmune issues like multiple sclerosis and things of that nature. But the point is that chronic pain can be a big deal, so we need to treat it and really get after it. For Ehlers-Danlos patients, one of the best ways to approach treatment is to tighten the loosened joints. And when these patients really engage in weight training and strength building activities, well, they're firming up the joints and stabilizing them. If you reduce the motion in joints across the body by stabilizing them and building up those muscles, well, then you reduce the opportunities for aggravated joints. Plus, just the pure benefits people get from moving, activity, and being healthy. And all of this combines to combat ongoing chronic pain, which could potentially be effective at treating some of the other problems I mentioned that are connected to chronic pain. Now, if you need to find out why you're hurting so bad, but there's really no real reason for it, or if you're just ready to start trying to get back to your life after a time of being inactive and now you're hurting, why don't you give us a call at 806-355-3000 and let's get you some help. Let's get you back on your feet and let's get you back into your life. If you're watching us on social media, like, subscribe, share, and comment. This is the way. Until next time, I'm Dr. Jeff Williams. Be smart, and we'll see you then.